Artificial intelligence is all around us, from our devices to your cars. Now, thousands of physicians at Corewell Health will have it as a new tool at their disposal.
AI can now be inside the room with patients and their doctor. What's clear here is whether it's in your phone or in the hospital, AI is an inevitability, if not already in practice.
It's kind of like, when are people signing up for it, not if they're doing it or not.
Artificial intelligence is here whether you like it or not. Dr. Diana Bittner,
physician, board certified in OBGYN,
is the chief medical officer of True Women's Health. It's a field always looking to advance.
Any little thing we can do to take better care of patients.
AI is one of the latest innovations they hope can help.
Whatever tools someone can use to do that better, that's awesome.
Corewell Health just announced AI will now be alongside the patient-clinician conversation.
Really just helps organize that conversation into a format that works really well for our medical record and saves the time on the part of the provider.
The program is called Abridge. It will listen to and summarize patient-provider conversations and generate necessary documentation. They say the hours saved on paperwork can now be directed back to the patient.
It's a good thing. You know, it's great they're doing it. We're all doing it. It's the wave of the future.
Artificial intelligence is being used in a number of professional settings, including in the news world. We use it to help transcribe these really long interviews. It cuts down on the writing process afterwards. Our responsibility comes in when we have to make sure that what artificial intelligence captured is accurate.
That is why we have that human in the loop process. So it is absolutely a requirement that that physician afterwards reads that summary and that note and make sure it's accurate before anything gets finalized or sent out.
That assurance may not be enough for some. The core of the conversation surrounding AI has always included apprehension.
And they might not be as forthcoming in the discussion as they might be if it wasn't recorded. So in that sense, to me, that might be one of the most significant pitfalls.
Dr. Greg Gogolin is the Director of Cybersecurity and Data Science at Ferris State University. AI gets his name wrong. He says it may have catching up to do on medical terms.
That technology has been advancing so quickly, though, and if you train on a lot of medical information, a lot of that kind of takes care of itself.
By the way, Corewell patients can decline its use. If approved, all they may notice is a phone or a listening device recording.
And then as they go through it, that's about all they're aware of. What they're probably going to notice is that, wow, my physician was having a lot more of a conversation just focused on me and wasn't looking at the computer.
When providers can have a bit more time and space and not that burden of typing constantly while the patient's talking, then, and again, it frees them up to do what they love to do.
Now, another big theme with this is avoiding physician burnout. Typically only spending 12 minutes with a patient, but hours afterward, even time at home on that administrative paperwork, filling out what this can now do for them. This tech is now available at 21 Corewell hospitals and more than 300 outpatient locations.